World AIDS Day started in 1988 and remembered December 1st, 2022. World AIDS Day was first designated in August 1988 by James W. Bunn and Thomas Netter to get some semblance of control over the pandemic that had claimed the lives of so many people. James W. Bunn and Thomas Netter were public information officers for the AIDS Global Program of the World Health Organization. They conveyed the idea for the observation of this day to the director of the AIDS Global Program, Dr. Johnathan Mann, who approved it for December 1st. Since the 1990s, research and medical practices have made significant improvements in the care of people living with HIV. In 1988, when the inaugural World AIDS Day was observed, it was estimated that between 90,000 and 150,000 persons were positive with HIV, the virus that could lead to AIDS. Up until 1996, WHO coordinated World AIDS Day, creating the annual themes and events. After that, UNAIDS, the Joint United Nations Program on HIV/AIDS, took over these duties to raise AIDS awareness and integrate AIDS information on a worldwide scale. UNAIDS established the World AIDS Campaign, WAC, in 1997. Globally, there are an estimated 38 million people who have HIV. Despite the virus only being identified in 1984, more than 35 million people have died of HIV or AIDS-related illnesses, making it one of the most destructive pandemics in history. And that's what, those are the folks that we know of also, because think about it, there's AIDS-related illnesses, like I stated in the story, that if someone passed away, it wouldn't go under that umbrella. But, a lot of the medication that people living with HIV and AIDS are on, they have side effects. There is Brett's lymphoma. Okay, if you have HIV, you are 30 times more prone to get that type of cancer. Isn't that crazy? 30 times. But again, just like the story has said, we have really just gone leaps and bounds from where we were back in the 80s.
If I can ask everybody a question that is so central for me, that has led up to World AIDS Day and thinking about World AIDS Day today. On Wilton Drive, I live my life on Wilton Drive. It seems to me that many, or most even, of especially the gay men that I encounter on Wilton Drive and live around me, right? HIV/AIDS, it's not something that anymore. I've heard so many times leading up to Smart Ride and over the last couple of weeks, when I talk about all of the stuff that we've been doing for raising awareness on HIV/AIDS, the general reaction is, why? Think about that in terms of visibility.
I would say that I would edit what you said slightly. I would say that they do think about it, because we know that people are getting tested and they're making sure that they can get off PEP. But I don't think that they fear it. I don't think the same fear exists
of dying.
Exactly, because you can live such a healthy life now with HIV, and so many young people have grown up knowing that there are ways to treat and to live that way. So I don't think fear is.
You pick PEP, right? Like for women, if you have unsafe sex and there's a morning after pill. Well, there's something similar also, right? That is PEP, and so then you can take post-exposure prophylaxis, and so then you would take a pill for a couple of weeks.
That's true. My concern going along with what you said is that, and I speak to patients, especially young people, all the time, without that fear, there is a real difference between being HIV positive and HIV negative. And yes, the medication has come a long way, but like they just read, if you have HIV, you have a 30% higher chance of getting certain cancers.
Absolutely.
Like, it's not the same. And I'm thrilled, because I was around in those days in the 80s when we had nothing. And to work in healthcare and not be able to help someone is devastating. I'm thrilled to where we're at, but I'm always emphasizing it's not having HIV is better. If you can get on PrEP, there's so many ways to get on PrEP now. You can get an injection once a month.
Right.
If you can avoid it, one less thing that you have to worry about. We don't know what happens to the human body when you're on medication for 40 years.
Yeah.
If you're 20 getting HIV now, I don't know what's going to happen to you when you're 60.
You're right.
You've been taking powerful medications for 50 years.
Absolutely.
Try it. Get tested. you need to be treated, get treated.
Know your status.
Know your
Know your
status.
status. That right
please.
there.
You know?
LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Lara are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.